While technology pioneers like Elon Musk are focused on taking people to the moon, our guests today on Tech Talk have their feet firmly on the ground. They are aiming to develop what they say is the world's first all-terrain X-ray machine. Let's go have a look. Thank you both for being with us today.
Thank you.
So when I think of an all-terrain, mobile sort of X-ray machine, I have to be honest with you, it's not exactly what I had imagined. This is quite a bit larger and seems more difficult to move than I had in my mind.
Yeah, the reason is very simple. And actually, if you go back to what the WHO says, the first X-ray machine that you want to have in a district hospital needs to be a fixed one and not a mobile one. And there are reasons for that. It's actually because it's better for radio protection, so it's safer. And so there's a good reason for that. And also for the ease of use. A mobile one is more tricky to get good images.
Okay, but they do exist, mobile.
They do exist, and the second need that you would have after the fixed one would be a mobile one. So I'll let you guess what we're going to be doing next.
All right, so this is in the pipeline, the mobile version. For now, this is a fixed version, but what makes it very special is that you can set it up anywhere?
Yes, it has been designed for the roughest climates, also for countries where there is no access to stable electricity, there is no lack of trained people. You have rough climates, as I said, high temperatures, humidity, dust, and it has really been designed for these contexts, and also for countries where the costs are very tricky. I mean, this is one of the objectives here was to have a very low-cost solution.
Okay. I want to get into the details of how it works, et cetera, in just a moment, but just to understand your relationship. So you are the director of the University of Applied Sciences of Western Switzerland, and you are with EPFL,
yes,
mostly, among other things. How did this collaboration come together? And actually, what role does each of you play in your...
There is a funny story behind this. So 5 years ago, I became the first president of University of Applied Sciences and Arts, and my friend Klaus called me because we know since our early ages in science, and he wanted to introduce me to this project where already a number of groups in our school, in my school, had collaborated, but there was fund shortage at that time, so...
Fund shortage?
Yeah.
Wow. Is there always a fund shortage? Or
there is
always a challenge, right?
When the phone of the president rings, generally there is fund shortage. So Klaus, I think he knew that I had a special sensitivity to this kind of topic.
Why? What about it?
Yeah, because I think science is not only for rich countries, science is for the benefit, for the wealth of the entire population of the world. So I think if we are lucky enough to live in this northern part of the world, we have to be generous enough to share our knowledge and make it profit to other population. And Klaus told me that more or less there is one person out of two in the world that has no access to this kind of X-ray diagnosis.
So 2/3, no, of the world's population?
Yeah, absolutely. Yeah.
And so I said, okay, we go on with the project.
Okay, sign me up. Where do I sign?
So
Yikes.
I signed because I think there was also a unique chance for a University of Applied Sciences to collaborate with a research university like EPFL. And our knowledge really fit, and our way of developing research fit very well. We are very much on the applied sense of the research. And also a machine like this, as you see now, it has a lot of technology behind, but
it's hidden. It's hidden because it's very it's very plain on the front, but yeah.
But there are also other problems, and since we have healthcare school, our partners from healthcare school could collaborate, but also design. I think this is important. When something is developed...
Because you're Italian.
Well, I'm Italian also, but I think that even if there are poor population, they deserve also something that is user-friendly, nice,
aesthetically inviting, and not scary, right? Because that's also a challenge. You don't want to scare people with.
And there is also a problem of ergonomy that has been solved by our schools. So we had a set of competencies that could really fit together for this project.
And your passion was there, obviously.
Yeah,
as
of
course.
Said. I mean, when I think in my job you have a lot of problems when you have a big university, but there are also dreams behind. And so one of my dream is also to develop something that is impacting the society at the highest level. So education and applied research, I'm convinced this is done for the good of the society overall.
And this, of course, is a passion project of yours. Walk me through those first moments of saying, I want to build an X-ray machine from scratch, and what motivated you?
Yeah, I spent actually, after meeting with Luciana in our PhD studies, I spent 10 years in the medical device industry. And at one time, I came across an annual report from a big medical device company where it said that they were selling 90% of their products in Europe, the United States, and Japan.
90%?
90%.
All right.
And it's a very big healthcare company.
Wow.
I just couldn't understand why there was this huge unbalance between industrialized countries and low-income countries, which were virtually not consuming any of those devices.
Yeah.
And so that actually prompted me to leave my company and start up a foundation first, where the idea was
very life-changing decision.
It was.
Yeah.
It was. And I was joined by two wonderful people, Beat Stoll, a medical doctor, and Bertrand Kleber, an entrepreneur. And we really had a vision to say, we cannot just tweak an existing X-ray machine. We have to rethink it for that particular context. And this is not just held on us like this. It really came through long discussions with healthcare people in the countries, and in particular in Cameroon, which was a country where we had some good contacts. And actually talking to the head of districts, we asked them, what are your 10 most wanted medical devices? And the one that always came up was X-ray.
Wow.
And there's a good reason for that. I mean, if you look at low-income countries, there are between 20 to 50 million road traffic accidents every year. 90% of those victims live in low and middle-income countries. So if you want to diagnose a fracture, there is no better way than an X-ray machine. And they didn't have, and yet 2/3 of humanity don't have access to them.
Right.
So this is a huge burden for these countries. Not only for people dying, but also all of the handicapped people that are a result of this problem of diagnosing fractures.
Right, and diagnosing things like, I don't know, tuberculosis
exactly,
or other...
pneumonia, it's 20%
pneumonia.
of child mortality, which you can diagnose with X-ray for some complications also. So this is really an essential tool, and yet it's not available. So that was really our starting point. And then we started talking to EPFL and Luciana, and there was just this wave of support, which was wonderful. And Luciana didn't mention the students. But it was really crazy. They love those kind of projects.
Yeah.
This is really something that inspires them.
That's
this
great.
is also something that I find absolutely fantastic.
That's great. Now, of course, as we mentioned earlier, I mean, this isn't the first X-ray machine to be taken to a developing nation, I assume, or will be taken, because this is the prototype that we're looking at.
Yeah.
We hope to.
Yeah.
In 2 years, right? You're
In 2 years,
you want to take this to market. But anyway, the idea of taking this, it's not the first time somebody does this. Why do you think this is going to succeed where others have failed?
WHO has found out that about these 2/3 of humanity in 1975, and launched a call on the private sector to develop solutions which would be adapted to the context. And nothing came. I mean, there's really nothing of value, because existing machines, when you transport them to these contexts, they fail very quickly.
Why?
Because of the climate, because of unstable electricity, because of lack of competence locally, lack of access to trained people, because of lack of funds. So all of these reasons force you to redesign something which is really adapted to the context.
Okay, and this is what you've achieved with, hopefully,
yes. We hopefully, yes.
with this machine. You were talking about, interesting, because at the end of the day, you know, for the world, for business people everywhere, the idea is also to save costs on healthcare. So can you stand behind that? Can you say this is really going to be helpful in terms of keeping these costs, this burden down for governments and for private organizations?
Yes. Well, there's two ways to answer that. The one is total cost of ownership. We never look at cost, and that's actually one of the problems. If you look at it only under the angle of purchase price, you may find Chinese machines or machines from other countries which don't have any durability. Well, you will put them in place and they will last for 3 months. Whereas what we want to achieve here is a 10 years of life cycle with real efficiency in the context. So you have to calculate what that means in terms of cost. So we always look at the total cost of ownership. And we can say, and I cannot go into details, but we can say that we have reduced that total cost of ownership by several times. The other thing which is really important is also simply the fact that when you had your old stereo machine, which still works after years, and the new ones that fail after 3 months, and you have to, to buy another one. This is also a way to save cost if you have more durability built into the machines. And I think in Switzerland we have that ability to design very good quality and robust stuff, and we should use that.
I would like to add that costs for healthcare are always taken in too much narrow perspective.
Okay.
We should consider costs for the society. Imagine what is the cost of a person that is handicapped for the life, cannot work. I can imagine in low-income countries it's a burden for the family more than for the society. This is also a cost that is not directly on the bill of the Ministry of the Healthcare. But if a country can have a more healthy population on the long term, this will be, in a way, give the rentability of this machine in a certain sense.
Tonight, one of your guests is actually Mr. Schneider-Ammann, who he seems to have really supported technology and innovation in Switzerland as part of his, I don't know, what part of his role. Why do you think the Swiss government has embraced this idea, this project?
Well, I think
and what does that mean?
There is a lot of Swissness in this, I believe, personally, but that's my personal belief. I mean, we have in Switzerland a long tradition of humanitarian action with the ICRC, with international organizations. And so, and we have neutrality, so, and this sense of quality. So there's many reasons, Mr. Schneider-Ammann is from the machine industry. So he understands what it means to make good quality, robust stuff. And yet he's also in Switzerland, where you have that humanitarian tradition. So all of that together, I think, is really nicely illustrated by a project like this one.
It's difficult to imagine what a ministry or federal council can think, but I believe also that Schneider-Ammann, as Ministry of Economy, not only of Education, he realized that the market is not only the market of the north part of the world, but there is a lot to do for the south market, but it has to be adapted. So this is something that I have learned from Klaus, is the appropriate technology. We cannot sell our own technology that is adapted to our needs, but we can open new markets if we are able to adapt to the needs of this country. And I think Schneider-Ammann is sensible enough to this argument.
You recently announced in August that you got your first 14 million in solid investment that it's going to take you supposedly through the next 2 years. And it's safe to say that your first market will be Africa, because 2 of your investors are in fact African. Can you walk us through a little bit of how that came together?
Well, first of all, we had kind of maybe a false idea that we would find solutions from so-called impact investors. And as we found out, there is a lot of hype behind impact investment right now, but we couldn't find those investors who had really an appetite for investing into early stage ideas with sufficient amounts. We're not talking about $100,000. we're talking about several $1 million to industrialize such a machine. So impact investment was not the solution that we found. It was not a solution for us, and we went to VCs. And that was another interesting learning. When you talk to VCs, oftentimes it's all about some buzzwords. And I'm being a bit critical here, but it's a lot about buzzwords such as AI and blockchain and drones and things like that, which I understand why. But and when you say your market is 2/3 of humanity starting from the bottom of the pyramid, meaning mainly Africa, then their reaction is, oh, that's philanthropy. When in reality, this is an untapped market. There's a lot of unmet needs there. And when I was in industry, unmet needs meant market opportunity.
Of course, the challenge when you work with emerging markets like Africa, developing countries, is to convince investors that the risk is manageable. How do you do this?
Well, I think we were lucky, first of all, to be in touch with visionary Swiss investors, and I want to insist on that. They were really visionaries, but they were people who had their own vision on business, and they thought this is something which can be achieved and which should be achieved. So there is also, probably some ethical reasons why they want to push such ideas. And then there are the Africans, and they absolutely clearly see an opportunity there. And one of our investors actually is working in diagnostic imaging in an African country. So he's facing the issues directly, and he sees the needs for such kind of technologies right away. You don't have to pitch it to him.
And is there more money coming?
Well, I would like to say that we are blessed with the situation because we've been able to raise enough to bring us all the way to break even. So that's another very good thing. In our program, during the development phase, we are developing the technology and the business models as we are still in the academic setting. So we were able to de-risk it sufficiently for investors to feel confident and put in enough money to lead us all the way to a break even, which is quite unique because in that case, our CEO doesn't have to go out look for more money. We're already ready to get this product up to market, ready for market.